The WCA home has private rooms for seniors who need assisted living. We are a nonprofit home founded 125 years ago for women, now seeking approval for men. Our mission has always been top-notch assisted living. Westfield Memorial Hospital provides high-quality health care to residents of Western New York, offering patients the most sophisticated medical advancements while keeping the ease and familiarity of a community hospital. Support for Chautauqua Sunrise has been provided by WRFA 107.9 FM, Jamestown's public radio station, streaming online 24/7 at WRFALP.com. Low power to the people. Funding is provided by a grant from New York State Senator Catherine M. Young, representing Western New York's 57th District with a local office in Olean. Chautauqua Sunrise is made possible by a grant from Fredonia Place, a continuing care retirement community providing dignity in a modern luxury environment. Meter's Restaurant, a family tradition for over 50 years in downtown Ripley, is a proud supporter of Chautauqua Sunrise. Meter's provides all-day dining, banquet services, and custom catering, specializing in pie. From the Access Chautauqua Studios in Mayville, it's Chautauqua Sunrise. Chautauqua Sunrise is hosted by Doc Hamels and supported by the award-winning volunteers at Access Chautauqua. We are here to share local news, colorful interviews, and events of interest to everyone. Chautauqua Sunrise is broadcast live Saturday mornings each week from 9 to 10 a.m. Send events via email or call us live. Check us out on YouTube and Facebook. And now, from the Access Chautauqua Studios, it's Chautauqua Sunrise.
Hey, good morning, everyone. I'm Doc Hamels, and welcome to Chautauqua Sunrise. We've got a great edition of Chautauqua Sunrise in store for you today. So please, I hope that you can stick around and watch us live. And if not, as you know, we're on at 2 and 8 here at Access Chautauqua on 1301. Also, you can always catch us on YouTube, which will go on forever and ever. Well, Justin, I see you didn't win the big mega ball, so he came to work today. Emerald's still here. She didn't win any money. Jeff's, we're all here. Nobody won. It's a pity. Anyways, that was pretty exciting. $1.something billion. What the heck do you do with that much money? I have no idea. Maybe
buy a dog shelter and you keep all the dogs.
Buy a dog shelter. Yeah. Take it. That's a good humane thing to think about. Okay. Folks, I always remind you that this is a call-in show and we are live. And if you have a comment for my guest or announcement for your club or organization, do call us at 753-5225. Love to hear from you. Don't be shy. And if you are a little shy and you don't want to talk to me live on the air, you can just tell the operator that answers the phone, whatever your question is. They'll tell me through my earpiece or send me a note here within the studio, and we'll get it right here on the air. You can also Twitter us. You can go to Facebook. You can email us. Whatever it is, we'd love to hear from you, and that's what Chautauqua Sunrise is all about. I have a few things to share with you. First of all, I want to wish my lovely daughter happy birthday, Stephanie Lee Dowd, and she's the proud owner of Bella's Salon over in Northeast. There's a little advertisement for you, Steph. But she's 36 today, and so proud of her. She's done so well for herself, and she's becoming quite the businesswoman. So happy birthday. We'll catch up with you later. Want to remind you that this is still Breast Cancer Awareness Month, and we're going to be wrapping it up today But that doesn't mean just because today is the last time we're going to talk about it, because we talk about all kinds of health issues here all the time. But please, please, if you have any concerns or you haven't had your mammogram, and remember, men or women, doesn't matter, please get out there and get tested throughout the year. And my good friends at Westfield Memorial Hospital are happy to work with you, or any hospital here in Chautauqua County. Halloween is coming, and they've decorated my work area here. So we've got pumpkins and skulls and rats and mice, and my good friend the spider, he used to hang on from the air. What was that?
I said Lucas the spider.
Oh, that's Lucas? Oh, I never knew his name. And we've got some new pictures here. I'll kind of get out of the way. You can see that Randy is responsible for that. Just absolutely gorgeous, gorgeous pictures. And you'll see another one later on in the show behind my guest, who's waiting in the green room patiently. Want to also remind you that Halloween is this week, and please check the hours of each of your towns. Generally, for instance, like Ripley's from 6 to 8. I know Westfield's similar. They have a big parade and all that sort of thing. Please make sure the kids have reflective material on their costumes, a flashlight, whatever, and check the candy. Okay. And then finally, just keep it in your mind, keep it on your calendar. November 6th is vote day, election day. And as you all know, I am non-political on my show, so I don't care really who you vote for. It's just vote. Exercise your right to vote. And so many countries wish they had what we have. So please, November 6th, get out there and vote. Okay, enough on that. I'm going to go through some announcements, and you guys are doing a good job. You're sending me lots of stuff, and I appreciate that, and I'm happy to share this. But before I do that, I just remember, I want to say good afternoon to all my listeners on WRFA 107.9, low power to the people in Jamestown, Tuesdays at 1 o'clock. Thanks for joining me, and I think this show today is going to be of great interest to you as well. So to my viewers and my listeners, hello. Okay, we're going to start out in Westfield. And this is for today only, because today is the last day to talk about it, because this event takes place today. The annual Gold Rush barbecue and cash prizes up to $1,000 today. The Westfield Mayville Rotary Gold Rush, that's my home club. Now, I'm going to read this because it's just so well written. A mouth-watering chicken and ribs barbecue dinner, lots of laughs, and suspense-building reverse draw raffle for cash up to the grand prize of $1,000 are on the menu for the Rotary Club of Westfield and Mayville Gold Rush event. And there's going to be a lot of people there tonight because we didn't win the $1 billion. But you can win $1,000. Will you be the holder of the cash winning ticket? This fun, casual affair is set for today, and it starts at 6 o'clock over at Easton Hall in Westfield. Chevetta's barbecue dinner will be served from 6 to 6:45. It includes a barbecue chicken and ribs, baked beans, coleslaw, roll and butter, as well as dessert, soft drinks, coffee, and water. Adults are reminded that it's a BYOB, bring your own bottle event. Everyone is invited to bring their favorite beverages and snacks to enjoy during the drawing of the tickets and have a party within the party. It's a great time. I MC it every year, and we try to keep it moving and lots of fun. Beginning at 6:45, there'll be the reverse draw raffle for cash prizes from $10 to $1,000, plus a 50-50 ticket drawing for more cash. Raffle participants must be 18 years of age, and winners need not be present. Tickets are only $30 a person. Now you might say, but you get dinner? From soup to nuts, really, and then opportunity to win some money. And remember, there's only 275 tickets, so the odds of you winning is better than the $1 billion. This is a great deal. So interested folks are encouraged to get their tickets at the door tonight at Easton Hall. You still can get, there's still a few tickets left. If you want to know right now what's going on with the tickets, give Linda Dunn a call at 326-3012. Okay, and remember, this is a charity fundraiser, and the monies all go right back into our communities. Our club does a lot of service projects, and so I hope you can be there. I'll be there. And if you do come, please come up and say hi. I'm always happy to chat with listeners and viewers. Okay, still in Westfield is the Chicken and Biscuit Dinner. Okay, moving right along. Is the Westfield Memorial Hospital Auxiliary. Look at that chicken. Or is it a rooster? I don't know. It must be chicken. This is a chicken dinner. It doesn't say rooster and biscuit dinner. It says chicken. All right, from 5 p.m. to 6:30 p.m. held at the Presbyterian Church in Westfield on November 5. Adults $10. Children under 10 or $5. It's a sit down or take out, so it's up to you. All right, let's go to Ripley. They're having their annual fall shoot and gun raffle, and that's going to be held on November 4th and 11th. It starts at noon each of the days, and there's the information. Kind of hard to read, but check it out with the club, and I know that's a well-attended event, and there are all kinds of prizes. Okay, moving right along. Girl Scouts of Western New York. I found out the other day that my little niece over in Ripley, she's a Girl Scout. And now I am a proud owner of soon-to-be covered raisins I think I bought. Or was it the trail mix? I don't remember. Well, anyways, with the start of a new program year, Girl Scouts of Western New York will hold a Girl Scout Join-a-thon November 14th from 8 a.m. to 8 p.m. and take on-the-spot registrations over the phone. This event will utilize 10 different radio stations throughout the 9-county regional service area to direct listeners to 888-837-6410 to register for Girl Scouts. And remember, they're out there selling all kinds of things for fundraisers and magazines, and they just finished up on their candy sale. Boy, oh boy, I can't wait to get mine. And so if you know a young lady that's interested in leadership program and getting involved with the environment, encourage them. Look at the Girl Scouts. I know many folks that went through the program, and they're better for it. All right, moving along, let's go to Jamestown. Adolescent sensitivity awareness. I think this is a new one. A practice used to heighten communication and self-awareness is being presented by Kimberly Earl. This is going to be held on November 15th from 9 a.m. to 12 p.m. at the Salvation Army Anew Center over 83 South Main Street in Jamestown. It is brought to you at no cost by CASIC, which is Chautauqua Alcohol and Substance Abuse Council. Melanie Wachowski was just on here not long ago talking about some of these things. Pre-registration is required. The practice of sensitivity awareness instruction is a crucial part of communication and self-awareness with today's adolescents. School administrators have already witnessed the benefits of this practice through a hands-on after-school pilot program, which will be revealed in the training. The principles behind sensitivity awareness have proven to be a practical tool in helping students achieve greater success in communication, leading to greater success in academics and in life. This can be used as a 3 hours continuing education program and so on. So check them out over at CASIC. All right, and then we got a holiday auction over at Noble Winery. It's going to be held on November 17th. Boy, we're getting to that season already, Justin. I know you can't wait. He loves Christmas. He loves all the holidays. Silent auction is going to be held at 2 p.m. right at the winery, and it's a live auction starting at 4 p.m. What's this for? This is to support the Ripley Library. It's a $5 auction admission, which applies to any purchase you make. Toys, art, decorative items, baked goods, kitchen items, antiques, gift certificates, overflowing amounts of baskets of goodies, door prizes, and mystery boxes, holiday decorations, all sponsored by the Ripley Friends of the Library. They have a big fund drive going on right now for some new construction, and that's all part of it. So mark your calendars. That was November 17th at Noble Winery. Okay, going back to Westfield, we have a citrus sale. The Westfield Memorial Hospital Auxiliary is busy. They got their chicken and biscuit sale. They're also sponsoring, their citrus sale. We have a slide on that, number 19, I think. Okay, this is for the fruit comes out of Brijota's wholesale in Jamestown, New York. It's number one quality, it says. They're offering small mixed box for $16. You get 2 grapefruit, 7 navel oranges, and 7 clementines. Use $13 get you a 7-count of red grapefruit, $28 a medium box, 6 grapefruit, 12 navel oranges, 13 clementines. Half case of navel oranges, $28. It's between 30 and 32 count. Orders with payment will be taken November 1st to November 17th from any auxiliary member. Checks are made to the WMH Auxiliary, Westfield Memorial Hospital Auxiliary. Order forms available at Peaceful Designs right there in Westfield, the Great Discovery Center. And for more information, you can always talk to Gene McCausland And pickup will be at the Great Discovery Center on December 8th and 9th from 10 a.m. to 4 p.m. And we'll talk more about that. Okay, oh my gosh, there's more stuff going on. Let's see here. This is number 20, Christmas in the Village, Friday, November 16th. Okay, they got all kinds of stuff going on. And this is going to be in Westfield as well. They love Christmas in Westfield, I'll tell you. They have Dickens Carolers. There's going to be Santa coming. Armistice Project at the library. Live performance, A Christmas Carol by Tenrario. And we'll talk more about this as we get along. The next day, Saturday, is going to be the Hot Toddy Crawl. I have no idea what that means. Victorian Holiday Tea at the museum. Breakfast with Santa, a Holiday Fest magic, Christmas magic at the Patterson Library. Parade of Lights. Let's see, what else we got? Hall of Christmas, Dickens Carolers, horse-drawn carriage rides. Wow, all kinds of stuff going on. There's going to be a Brenda Eno Art Gallery is going to have things going on in there. And then Sunday the 18th, we've got the Victorian Christmas service at St. Pete's, and then a Christmas show at Center Stage Dance Studio. Woo! So Westfield is lighting the lights, and they're going to be really into the holiday season. Okay, next we have a Home for the Holiday Palette with Renee, and this is December 1, 2 p.m. to 4:30 p.m. at the Great Discovery Center. It's $25. Renee will paint home for the holidays on a 14 by 16 inch palette. Wines and snacks available to purchase during the event, and I believe that's where you all learn to paint together, and they're going to have a nice piece to take home with you when you're done. Okay, I think that's all the announcements I have, other than the two that I have here. And a reminder that the Blue Star Mothers are having a raffle to support our military, and they're having this throughout the next couple weeks, and the drawing will be held at the Lakewood Rod and Gun Club on Sunday, November 11th. The donations are $5, and they gave me a sample of it's a red ticket like this, so check that out. And then today, October 27th, from 10 a.m. to 2 p.m., they're having National Prescription Day Take Back Day. That's the title. At the Chautauqua Mall, over near the Penny's parking lot, the Southside Pharmacy in Jamestown, Westfield Family Physicians, and All-Star Ambulance. If you have any pills of any shape or form, bring them to those sites and get rid of them, because you don't want them still sitting in your homes and so somebody can get into them. So I'm going to be quiet. We're going to have a public service announcement, and we'll be right back.
Eva Marie smoked 12,000 packs of cigarettes over 15 years. She quit, and now there's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. No matter how much you smoked, early detection could save you. Talk to your doctor or learn more at savedbythescan.org.
Okay, we're back. I was watching that commercial, and I was thinking when I was a kid, smoking was pretty prevalent. And then all of a sudden, there was this, the Surgeon General came out with, there's a possibility that smoking can cause the cancer, and you shouldn't be smoking. And I used to go around breaking everybody's cigarettes and hiding them on people and things like that, because I never smoked. I never did. Yeah. I think I might have been a little inebriated at a wedding one time when I was younger, and I tried a cigar, and that was that. But oh no, when I was 5 years old, my step-grandfather gave me a cigarette because my brother was just had to have a cigarette. So I remember just about throwing up in the toilet. It kind of turned me off the cigarettes. If you're a smoker, I'm sorry. Please don't smoke. It's connected to all kinds of problems. And if you do, it's your choice, but I'm not here to get on my soapbox, but I've just seen way too many problems with smoking and so forth. And there's other behaviors that we have in this world that cause health issues. But anyways, so I'm smoke-free. I don't smoke. And with that, it's my pleasure and just so pleased to have in the studio today my goddaughter, Jennifer Hamels-Sullivan, who is the health promotion specialist for the Lung Association. Good morning.
Hello.
We finally got here.
We finally got here.
We
Finally did it.
We finally made it.
We've been talking since May.
About well, this. And I've been trying to get you on the show for like ever.
Years.
And
Years.
So here we are in our 5th season. Finally got you here. So
yeah.
Thanks for coming in from way up in Eden, Hamburg.
Eden, New York.
You had a good drive in, or was it foggy?
I did. It was super rainy and lots of trucks on the road, but you know, in true Hamels fashion, I made it here, no problem.
Yeah, only 7 minutes late.
Yes, exactly.
We have plenty of time to catch up.
No, that's fine.
Okay, so let's see, what was I going to say? So, Jen, you have been involved with health and so forth for a long time. So
yeah.
Tell us a little bit about your background and how you got involved.
Sure. So I've spent about 20 years working in public health. And so that said, I've done a lot of work around cancer prevention. You were just talking about the public service announcement for tobacco and smoking, and we'll get into that in a few minutes.
Sure.
But a lot of work around that. And physical activity, nutrition, you know, all the whole gamut across public health. And I love it. As you know, my mom has been a nurse for longer than I've been alive. And you know, she really set that tone with me early in life about just giving back to the community and taking care of people. I didn't want to necessarily follow in her footsteps from a nursing perspective, but you know, you
not
and I
into
have
those needles, huh?
No, not into the needles. But I have a lot of friends, and even my sister-in-law who is a nurse, and I have great admiration for them. And but I chose the public health route because I just feel like there's so much work to be done. And so that said, you know, I spent 13 years with the American Cancer Society, and I've spent the last 5 of my career with the American Lung Association. Excuse me. And so I've done a lot around asthma, and now the big push right now is lung cancer. And I'm thrilled to be on the show today because not only are we wrapping up with focusing on a major cancer topic of breast cancer awareness, and I'm so happy that you mentioned to your viewers about getting your mammograms. It's so important, both men and women, so thank you for mentioning that. But also in November, we start Lung Cancer Awareness Month, and we've got...
So here we are, kicking it off.
Yeah, we are kicking it off, and I'm so excited to see you in your turquoise.
Well, I had to wear this because not only did you... my little handkerchief there, I got to pop that up there. I got to look classy here. Leonardo DiCaprio now. I had a... Well, maybe not. This skull is in the way here. Let's move him over. Okay. There we go. Now you get the full thrust of that.
Full entourage.
There we go. Yes, thank you for the tie.
You're welcome.
You said, do I have a turquoise tie? I said, no. I don't know.
Now you do.
People that do. So is this your official logo color?
It's the official color, yes, for our Lung Force movement that we started 6 years ago.
We have your logo. Let's pop that up, Jeff, so we can see the colors and people might get used to seeing that out and about.
Yeah.
There we go.
Oh, look at that. Yeah, beautiful.
My tie matches that like perfectly.
Yes. You'll see I've got my little swish.
Your swish.
Okay,
thank you. Okay, so Jen, I know you, but they don't know you. So you told us a little bit how you got involved, but
yes.
where were you born and raised, and tell me a little about your family, whatever you want to share.
Sure. Well, as you know, being my godfather and knowing me longer than I've known myself, I was born in Buffalo in 1976, and
you don't look that old.
I know, right? January 7th, 1976, the bicentennial. 1776.
And also your dad's birthday.
And my dad's birthday too.
My brother.
So I'm super excited every year, and I always ask him if I'm still his favorite birthday present, and he does concur. So it's pretty special.
Okay.
All kidding aside.
So where'd you go to school?
I graduated from Frontier Central in 1994, and then went on to Slippery Rock University down in Pennsylvania and got my bachelor's degree in community health.
And they specialize that
yes,
down there.
Yes.
Because I don't know too many places that do that, do they?
No, there are a few colleges, and I can't think of them off the top of my head.
Right.
I know there's a couple of the SUNY campuses here in New York State that have, but in
this area, that's sort of like the place to go to, from what I understand.
Yeah, and they've actually changed it to public health.
Oh,
so
okay.
Now I have a bachelor's degree in public health, and I have a minor in gerontology. I love my elderly folks, so all of your viewers out there that are wonderful, seasoned folks, I love you dearly. And,
So what you're saying, us old guys?
No, I didn't say old. And I also got my master's degree at Buffalo State College.
All right,
and,
that's my alma mater.
Yeah, yes, it was, and you actually, it was really cool that you and my dad were able to walk through the ceremony with me, and I got that. It was pretty special, and that's in education. So I have my master's in education, and do a lot of work with school districts and superintendents. Some of your former colleagues.
Some of my buddies. Yep.
And but did a lot of work, around tobacco in college campuses for years and years and years.
Okay.
5 years, I oversaw a project for tobacco with college campuses, trying to get tobacco off of college campuses, and really embracing the philosophy of respect for others, respect for the college campus environment, more so than tobacco is bad for you. You know, one of the things you had mentioned in the beginning of the segment when we were talking about tobacco and smoking, and the fact that you haven't, and that's awesome, is the fact that smokers are not bad people. And I want to make that very, 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 very clear to you.
Some of my very good friends are
viewers.
smokers.
Yeah, no, but the point I want to make is there's a lot of shame that goes into this addiction. And the one point that I want to make is that people who are addicted to tobacco, whether it be cigarettes, whether it be chewing tobacco, the tobacco industry has millions and gajillions of dollars, you know, more so than the lotto winner, that
That's a lot.
that target young people all the time. And the average child between the ages of 11 and 15, which, as you know, my son is 11, so we're creeping up on that, and he's very adamant. Luckily, I've done a good job of educating my kids about not trying tobacco and the deadly effects of it. So they're pretty adamant about not. But the average person starts between 11 and 15, and unfortunately, once you get addicted to nicotine, it's a really, really, really hard addiction to let go of.
All right, before we go any further,
Sure.
we would be remiss if you didn't do a shout out to two important people.
To my kids,
That's up to you.
my two favorite little children, my Joshua Sullivan and my Emily Sullivan. Hi guys, love you. Hope you guys are getting ready for Emily's game.
And Tom is taking good
And
care of it.
Tom is holding down the fort at home. I love you, and you're an amazing husband, and you have done a great job supporting everything that we're doing as a family. So
Just hello would have been fine.
yeah, sorry. Got to get it out there when I can.
Okay, I got to tell you a funny story. As you know, hold on a second. Your dad and I grew up, and we were only 11 months apart. He's younger
Yes.
than I am. And we were maybe like 11 and 12 years old, somewhere, just that age group you were talking about. And I think I told you this story, but I'll share this with my viewers and listeners right now. So in the wintertime, what do we always do? We always go outdoors because you got to get outdoors, and we're making like a fort, an igloo type thing. And I'm inside, and I'm carving the inside of the cave. And I'm on my back, and I'm carving the thing, and all of a sudden I can't breathe. Couldn't breathe. I thought, what the heck's going on here? And so I quickly get out of there, and I'm going like, I'm coughing, and you know what was going on? Your dad was sneaking the smoke at the age 11, and he was blowing the smoke into the snow fort so that my grandmother, who was watching this, couldn't see him smoking.
Oh my goodness.
I think you're trying to
Boy,
kill
am I
me.
going to have a chat with him later on.
But he was at that age,
Yeah.
you know, of 11, 12 years old, and funny stories about him smoking. So I'm just so glad he quit finally after many
Yeah.
years of smoking.
Yes,
But
absolutely.
but that age group is definitely, and they're being targeted, as you say.
They are. They're being targeted, and the tobacco industry is relentless, quite frankly. I mean, vaping is the new thing, and that is, you know, even in our northern school districts has been quite an issue as of late. And so the administrators, my hat's off to them for trying to come up with creative ways to be able to handle this, and I'm going to work a little bit closer with them on that, because they just they're relentless. They need to replace the smokers that unfortunately pass away, that are dealing with all the lung diseases that, you know, we at the American Lung Association are dealing with on a regular basis. And so, like I said, one of my main messages to the viewers today is that don't put your shame aside from this. You're not a bad person for doing this. You're just the product of a really awful industry that took advantage of you and took advantage of your health. And so now people like myself who are working for organizations that are really trying to send a message and come out with new creative ways to help you quit this awful addiction, that's what we're here for. So we have a lot of resources. I believe that we had our lung.org is one of our big resources that we have, and I believe it was up with my name a few minutes ago. Mm-hmm. And if there's anything that anybody can take away from this conversation today, is please go onto the website. Thank you. To lung.org, and it will give you so many resources on COPD, asthma, IPF, which is idiopathic pulmonary fibrosis.
Say that again.
Idiopathic pulmonary
fibrosis. Fibrosis, and
yes.
That's the texture and stuff inside your lungs.
Hardening, like lots of different COPD, asthma, hardening of the alveoli, those little tiny air sacs that were buckling on you when my dad decided to blow smoke at you. Oh, Lord.
Okay, I have a question for you.
Okay.
And I think Melanie Witkowski, I mentioned earlier,
mm-hmm.
She's with the Chautauqua Area Council on Substance Abuse and so forth. True or false? Tobacco is the most addicting drug in the world.
True.
And I think that's the
nicotine.
That's the part that people are like, what? Mm-hmm. They don't realize that it is so easy to become addicted to nicotine.
First time.
And
first shot.
And so I guess supporting what you were saying is that if you're a young kid and you want to be cool or whatever it is, the peer pressure to smoke, it's easy.
Oh, yeah.
But the thing is that they don't understand that it's an addiction to nicotine, a drug, and then the health consequences later and so forth. So, yes. but when we were growing up, even when I said, they would tell us not to smoke and then it causes issues, I never heard them say, this is the most addicting thing you can do in the world at the moment. And It still is, I think. Even all the drugs that are out there, this is the most mm-hmm. addicting.
It plays with the neurotransmitters in your brain,
mm-hmm.
and that's why there's special medication for people to try and quit, because depending on what your personality is and how addictive your personality is, how much that nicotine gets in there and really wreaks havoc in your brain. That's why you have Chantix, you have Zyban, you have all these different opportunities to be able to help you get off of that. And chewers too.
Mm-hmm.
I know a couple of gentlemen that have used chewing tobacco in the past that have also used Chantix. And, different people have different experiences with that. Sometimes people have very vivid dreams. What works for some people doesn't work for others. There's the patch, the gum. So there's definitely resources out there, and I guess that's my point. And,
mm-hmm.
With us walking into Lung Cancer Awareness Month, smoking is the leading cause of lung cancer. And so in saying that, I don't want people to feel shamed for that. I want them to be proactive and feel empowered to have a conversation with their doctor.
Know the facts.
Know the facts, exactly. Know how much you're smoking. Know how much you would save. I mean, a huge activity that I like to promote to people is, if you are trying to quit smoking, take the money that you would spend on a pack of cigarettes, which is ridiculously exorbitant. It's like over $10 now with the taxes and everything. Which, gas has gone, everything's gone up, since you've
mm-hmm.
been younger, and I, in my growing years and stuff, I remember.
Cigarettes were 25 cents a pack when I was a kid.
Yeah, and now they're over $10. So it's disgusting, and the tobacco industry is laughing their way to the bank every day, all day, and they don't care about the people that they're killing from it. And I don't mean to sound so grim, but with Halloween being here, and it's kind of a perfect time to talk about this. Your public service announcement, I was thrilled to have you guys put that on. Thank you.
Mm-hmm.
That was our Save by the Scan campaign that we launched last year with the Ad Council. And that is specific around lung cancer. SaveByTheScan.org is another website people can go to specifically for lung cancer testing. And there is a quiz on there that people can take. and they can go on there, and that will give you an idea if you're kind of a candidate to be able to go for lung cancer screening for low-dose CT
All right, well,
scan.
let's talk a little bit about that.
Okay.
So let's say I go to the website or whatever. So what are the questions like? What are they asking me?
How old you are, how much you've smoked. It's a pretty quick quiz.
And does it then kind of give you a feeling if you're at risk?
Yes.
Oh, so
It'll give you
kind of a
yes.
quick evaluation type
Yes,
thing?
yes. It's like 10 questions, and it kicks out, based on your answers, it'll kick out whether you are more of a candidate to pursue that conversation with your doctor.
True or false?
Okay.
Whether it's smoking, drinking, whatever we do in life, I don't care, whatever, we get used to a new normal. And sometimes we don't even realize that our health is deteriorated, or we don't even realize we're doing certain behaviors because it's our new normal.
Absolutely
but I
true.
suspect something like this might be asking you questions, and you're going like, oh, I guess I never thought about it's hard for me to go up and down stairs, or my legs are bugging me. I don't know what the questions are, but you know what I mean?
Right.
Does it
right.
kind of do that kind of a thing?
Yes.
Okay. So Saved by the Scan, what is that? I never heard of that before.
It's a campaign that the American Lung Association launched. So when we were talking about Lung Force earlier and you put the logo up, so Lung Force was developed 6 years ago. The American Lung Association really was proactive in their attempt at fighting lung cancer. And so we were, after an evaluation and seeing that there was a lot of women specifically that were dying from lung cancer, ALA really took that seriously and wanted to bring a lot of attention to it. So 6 years ago, we launched our Lung Force initiative across the country. And it's kind of a two-prong approach. We have a Lung Force Expo, which is a big day-long two-track, meaning a professional track, a track for education to healthcare professionals, whether it's nurses, respiratory therapists, social workers, physician's assistants, nurse practitioners, some providers. Continuing education credits offered, continuing medical
This is a big
education.
deal.
It's a really big deal. So I'm super excited to promote it. It's going to be on Saturday, May 11th, which is Mother's Day weekend. We had a lot of our planning committee members had suggested having it on a Saturday to get more providers to be able to come because
Sure,
they're in their
networking,
practices
yeah.
during their week. And also patients. So I mentioned that we have two tracks. So there's one for healthcare professionals and then one for patients, lung cancer, COPD, asthma, IPF that we just talked about a minute ago, chronic bronchitis, sarcoidosis, which my dad had, all these different lung diseases. That track, there's an agenda that's got different topics for resources and different treatment options and updates on different durable medical equipment, oxygen, need and reimbursement, those types of things.
So good information.
Really good information.
Okay, so is there a scan that people can get?
So not at the event, but the Saved by the Scan was born as a result of this big initiative taking place. So Saved by the Scan, again, with the American Lung Association partnered with the Ad Council and put together that lovely public service
But what I
announcement.
mean is there a scan?
There will be.
Oh,
so
there isn't
yeah.
yet.
So when you go on and someone does the quiz and say somebody, has smoked, for 30 years and they're smoking 2 packs a day, they're 55 years old or over, usually that's the age, they will get a summary at the very end of this 10-question quiz saying, you know what, you really need to go and talk to your doctor. And that's another important message.
All right, so the scan itself is not an actual machine, it's just this
It
big-
is.
Oh, but there is
No,
something?
it is. I'm
All
getting
right.
there. Sorry.
All right, sorry.
I know. We're taking.
I
I know. Right? It's always the way we've been. It's the way we communicate.
Give me the
Right?
answer,
Give
quick.
me the answer. So after the important part though is to have that conversation with your doctor.
Okay.
So you have to have a referral to go for the scan, the low-dose CT scan. So that scan is done at, like up in Buffalo, Roswell Park Cancer Institute does it, and you would have a physician, your primary care physician, you would have that conversation with them, and they would refer you to go and get that scan done.
So is it
So-
from head to toe?
Yes, it's like an MRI.
Oh, how cool.
If anyone has ever had an MRI done,
So
it's
shoot dye in you?
No, they don't. As far as I know, I could
So is
be.
it the tube?
Yes, it's the tube. They slide you in and they do the scan, and it's to try and pick up any nodules or any shadowing, anything in the lung area or other areas too.
Oh, but it says the whole body because
it's a full body scan.
that lung cancer breaks off and goes to other places.
It can
right?
metastasize.
I can't say that word.
That's okay. I'll say it for you. Metastasize, which means that you have your original site.
Yeah.
And then, so whether somebody's diagnosed with breast cancer, whether they're diagnosed with lung cancer, what have you, and then if one of those little stinker cells, breaks off and decides it's going to travel into other parts of your body, that's called it metastasized.
Okay.
And that's not what you want to happen.
Right.
So my message here to everybody today is to go onto the website, savedbythescan.org. And you can access that by lung.org if that's easier to remember. And go on and take the quiz. Okay. It's nothing to be scared of. Nothing at all.
You don't have to put your name in there or anything, do you?
I don't think so. I think,
In
no,
other words,
it's not.
anonymous.
No. Yeah, no, it's
just
a tool
Okay.
to be able to fill, like you would fill in your age, you would fill in whether you've smoked, how much you smoke,
Okay.
Those different things. And then it'll kick out, a recommendation. And then after that recommendation is made, if it says, you should really go and speak to your physician, then you need to have a conversation with your doctor.
Okay, question.
Okay.
My viewers might be saying right now, I don't smoke. I never smoked in my life, but my husband does.
Good question.
All right, so should they go on there and check
Absolutely.
it out? Because, again, a new normal may not...
Secondhand smoke.
They may not realize that they've got issues.
There's 3 different kinds of smoke.
Go for it.
Smoking.
All
There's tertiary, which is third-hand smoke. I'm going to go backwards here, which is the smoke that someone has on their clothing, on their drapes in their home, in their furniture. That's why a lot of healthcare systems now have mandated that their staff not be able to smoke while on shift or having to change, because if you're in scrubs and you come back into the room and are dealing with patients and they have any asthma, they have, that could exacerbate.
I have never heard of tertiary smoke.
Tertiary or third-hand smoke. Yeah.
I've heard of first and second, obviously.
Yep.
So that would trigger an asthma attack.
It could trigger if somebody's very sensitive and they have really, really bad triggers for asthma, especially smoking is a trigger for them. Just the right combination, COPD, any of those things, it can really, really affect somebody.
Okay.
Then secondhand smoke, which
Obviously,
is off the end of a cigarette and is
somebody else smoking.
Yes. And then first-hand smoke, which is you smoking on the filtered end of the cigarette.
All right.
So,
and so
filtered end, non-filtered end.
So at least for first and second level of smoking, types of smoke, they should go perhaps to lung.org and do the survey.
Yes. If someone's been exposed, I have a 52-year-old volunteer of mine, young lady, who's never smoked a day in her life, but grew up in a smoking household and has had COPD since she was my age, since she was 42.
Oh my gosh.
And it's very, very troubling for her. She's very active.
Does insurance pay for the scan?
Yes, it's
In most
supposed
cases.
to.
In
It's
most
supposed
cases.
to. Yes,
Okay.
I don't. There may be.
How long does it take? Do you know?
I want to say give it like a good half hour.
Okay.
Or so.
That's at
Anybody who's been
you
through an
mentioned
MRI.
Roswell, right?
Yes, Roswell.
And you know
Park.
us guys here, we support Roswell.
Yes, you
we
do,
Ride. I
with
don't know
the
how many collected
ride.
miles we have now, but we've put a lot of miles for that. So that's great.
Yeah.
Okay, I got 2 burning questions here.
Okay, lay
Okay,
'em
let's
on
start with the one that came through my earpiece. Okay, we heard from Melanie again about juuling and vaping. So
Yes.
talk to me about that, because we talked a little bit about it and what it looks like, but I thought maybe you could put a spin on it as well.
I sure can. And I'm glad you are bringing this up right now because it is a hot topic up north in my children's school district and other districts. I don't want to just call that one out, but in all the school districts right now. So juuling is vaping, and
Okay.
Juul is, I wish I had one I could show you. It looks like a flash drive.
That's what she said, a thumb
Yeah,
drive, flash
a thumb drive, flash drive. And I will tell you, my son, Josh, your great nephew, was terrified to go to middle school this year for that exact reason, because he was so worried about someone juuling or vaping with the Juul because it's so easy to hide.
Yeah.
So right now, the reason why, so you mentioned smoking over the years, and you mentioned, you and my dad, and, the thing with vaping now is because of the fact that, so the tobacco industry had to replace the fact that everyone was coming down so hard, master tobacco settlement, lots of money being siphoned into protection and protecting people from tobacco, and trying to put all these ad campaigns together to get kids not to start smoking or using tobacco. So, you know, the tobacco industry says, oh, we're totally on board with this and whatever, and, you know, they're really not. So their venture to keep people smoking was to start vaping, or electronic cigarettes as they're called.
Okay.
And so there are little canisters of juice, e-juice they call it, and they are put into all kinds of different mechanisms. There's lots of different ones that people use now, but the Juul one that you specifically asked about, it looks like a USB drive, flash drive, whatever you want to call it, and it charges in the side of a laptop or a computer.
Oh, we didn't talk about that part.
Oh yeah, you can do that.
Oh.
Yep, they can charge it up. Yeah. So that's why it's so easy, and it's so hard for school districts right now, and that's why kids are they're doing it on the bus, they're doing it in class when nobody's watching, they're going in the bathroom stalls and doing it because there's not the puff of smoke like there was with a cigarette. There is, and the smell, I mean, I have a friend whose stepson uses one, and she can always tell when he has because he smells like Fruit Loops when he comes in.
Fruit Loops?
Uh-huh. Fruit Loops, cotton candy, strawberry, cherry,
Oh, 'cause
caramel,
it's flavored.
all the smells, yeah. They were really, really ingenious when it came to making this be so not smoking.
Okay, now,
Does that make sense?
it does, but let me ask a question now. When the e-cigarettes came out, they were being flagged as the substitute for smoking and to be healthier for you. I'm not hearing that anymore.
No. There's still not enough information because it hasn't been going on as long as cigarettes use has.
Sure.
So we haven't got decades of research and studies around information, staying. The one thing we do know is that there is nicotine in it. So people will try and use it to bring themselves down in their use and try and use it as a quitting mechanism. That's what the original intent was.
Right, exactly.
And that was the tobacco industry's drive. Like, oh, we'll help you quit smoking and we'll help you quit using tobacco. Use these. So it still has nicotine in it.
Okay.
And the point that they try and make is to drop the amount of nicotine usage, so you're weaning yourself off it, kind of like using the patch. I would absolutely promote somebody using the patch over using an e-cigarette because one of the bad things also that goes with smoking and tobacco use is habit. So if you are smoking a cigarette and someone's trying to quit, using Chantix medication or any of the other medications out there, Wellbutrin or what have you, using the patch, using the gum, it's not a hand oral fixation.
Right.
It's a patch. It's putting gum in your mouth, which is oral, but it's still like chomping and you let that nicotine go in your mouth. When you're using a Juul cigarette or e-cigarette of any kind, because Juul is a specific brand, you are still using your hand to mouth, whether it's holding the canister or So you're still using that oral fixation, and you're not kicking that habit that's in your brain, to try and beat this.
So what you're trying to do is break the cycle of the muscle
utilization.
memory.
Yeah.
Okay, let's move. So if your kid's coming home and they're smelling like cereal or anything unusual, that should be it
could be an indicator.
This is the first time I'm hearing this.
Yes.
Okay, we knew about juuling because we heard about it, but I didn't know how they got charged, and I didn't realize that you could have some telltale smells. Okay, the next question I have on here is, you mentioned that women were dying at high rate of cancer due to smoking. Why women and not men? What's the problem?
They were using more, managing stress more, so utilization was higher. And everyone, both genders, process nicotine and chemicals differently and stuff. So when that happens, we all have cancer cells in our body. I think we've had this conversation before. Everyone is born with cancer cells in their body.
You for that.
So it depends on what you're doing to activate those cells. So whether you're smoking, and smoking can be linked to any cancer, any lung, any health issue, challenge that someone is facing. If you smoke and you're having problems with your health of any sort, diabetes, heart disease, cancer, anything, breathing issues, that sort of thing, you can pretty much take it to the bank that the smoking has something to do with it and is causing it.
Okay, on TV you see various commercials where they have victims of smoking and things like this, and but you'll see where the guy says, you know, I have to put on my artificial leg, or I lost part of my face, or I mean, I don't want to go into real graphic things, but I mean, they're out there.
No, the video.
So
out there.
how does this smoking here from my mouth end up down in my foot? I don't understand that.
Because the nicotine and all the there's over 7,000 chemicals in one cancer stick called a cigarette.
7,000 chemicals.
65 are cancer causing and cannot be put into a landfill in the ground.
Good Lord.
But yet we're damaging our temples that we call our body. So when you ask that question, if somebody's smoking a pack, 2 packs of cigarettes a day, or even not, you know, like I mentioned before, we all process chemicals and poisons and toxins differently in our bodies.
Okay.
It doesn't matter how healthy you are, if you're an athlete and you're a runner and stuff, or if you're not and you have other comorbidities, as they call them, or other health effects. So whether it's heart disease, diabetes, when you use tobacco, the nicotine and all that other junk that you're putting into your body is clogging up your arteries. So when you talk about going down in your foot, it's clogging up your arteries and causing plaque in there, and it's plugging it. So you have people that have circulation issues.
Oh my gosh.
Yes.
I see. That was another one of those aha moments. I'm watching these commercials and go, well, I'm not sure what's causing the issue, but you're seeing that.
Plaque. Plaque is causing.
Sort of like cholesterol, kind of like a buildup.
And if you have cholesterol issues and you're smoking and using tobacco, that's
double whammy.
That's a double whammy.
Now you use the word, and I know what it means, comorbidity. Kind of explain it to us a little bit more, would you?
Comorbidities are having many different health.
So like being
elements.
diabetic.
Yes. So if you have lung cancer or you have a COPD,
Okay.
all of a sudden you go to the doctors because you're still not feeling great, and they test you, and all of a sudden you have diabetes, and all of a sudden you have high cholesterol. So all of those different ailments are comorbid conditions,
Okay.
or comorbidities.
And morbid leads to death.
Yes, it does. So if you don't manage it and you're not having that conversation with your doctor, which is, I mentioned it a little while ago, and I'll mention it again, it's really, 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 really important to have that conversation with your doctor, to have a good relationship. People are terrified to go to their doctors. They don't want to hear what they have to say. They don't want to know. But if you want to live a long and prosperous life, it's really good to have a good relationship with your doctor so that they can help you manage those more comorbidities and make them not be comorbidities, and help you to live and manage, and diabetes and heart disease and cancer and all these different things.
I'm sitting here, Jen, and as you said, I've known you since before you were born. You don't sugarcoat this stuff, do you?
No, I don't.
And I appreciate that. I mean, because over the years people would be nice about it, or they would tell you little stories. But I mean, you've stripped it right down to, here are the facts.
Here's
it's your
the
choice,
facts. Yeah.
right?
Well, we only have a certain amount of time too, and I'm not brief ever.
Okay.
We go way back.
All right. So.
But thank you for pointing that out, because you know what?
Because I'm sitting here and you're passionate about it, and I appreciate that. Yeah.
Well, as I said, I've spent 20 years in public health, and I mentioned that I went to school for community health. And when I graduated from college, I was going to go out and save the world. I was going to go out and make everybody want to quit smoking. Tobacco's been a long time goal of mine, of getting people off it. And that said, people looked at me and were like, are you kidding me? Like, it's the only thing that doesn't argue with me. It's my best friend. It gives me pleasure because of the nicotine.
Right.
If nicotine wasn't such an awful drug, it would be an amazing drug because it gives you a high. It makes you happy. It makes people feel better for a limited amount of time until it goes out of your system, and then you have to put it back in again. Right.
Yeah.
So the nicey nice sugar coating has not worked. That's why we have so many people dying from these diseases, and that's why I'm not sugarcoating it. And I'm telling you that we have to manage this stuff, and people have to go to the doctors. They have to go and get their screenings done. So they go on SavedByTheScan.org, go on lung.org, see what you've got out there that you can relate with.
Okay. This is called Chautauqua Sunrise.
Yes.
Okay.
And I love it.
And we talked about this earlier. I always like to bring it home now to where I live here in Chautauqua County. Okay. I would say that I know fewer and fewer people that smoke.
That's great.
But that's my age group, because either they were enlightened, they got tired of not feeling well, or whatever. So I'm going to come back to that question because we have a caller right now, but hold that thought.
Okay.
So good morning, caller.
Good morning, Doc.
Hey,
Good morning,
Linda.
Jennifer. Happy Halloween. I love your decorations.
I had nothing to do with it. It was here when I showed up. But thank you.
Jennifer, your last name is Sullivan. I know a lot of Sullivans from Hamburg.
You do? That's great.
Now, Doc Sullivan, do you know Gene Sullivan?
I do not know Gene Sullivan. It's kind of funny that you bring this up because everyone thinks that my husband's family's related to everyone that's in South Buffalo and Hamburg, and ironically, they're not related at all. I don't know where they... I don't know. Maybe we need to do Ancestry.com and see if we can, find out.
Let's not go there.
I know. So.
Well, it's great to see you on the show, and thank you for sharing all this vital information with us about our health and answering the question that, yes, nicotine is the most addictive substance.
Yes, it is.
Yeah.
So what's going on in Linda's world?
Well, Halloween is coming, and we've had a beautiful autumn. Mm-hmm. I'm still screening for people. I'm looking for transport aides, people to help with driving in Jamestown and Dunkirk. Mm-hmm. I need a computer clerical assistance in Faulkner.
Oh, that's new.
Yeah. So I've been screening for it. I put the notices on the Department of Labor website, too.
Okay.
People should go into that, America's Job Bank. They can get that on the internet. Mm-hmm. So I'm looking for people, and they're also doing a lot of health insurance counseling at the Office for the Aging in Mayville, Dunkirk, and Jamestown. And the number to call...
Here it is, right in front of you. Go ahead.
...is 753-4471.
All right. And that's terrific. So you getting ready for the holidays?
Yes. Well, the holidays always come. And they come whether you're ready or not.
And they come in a bunch, too. They kind of wear you
right.
out, don't they?
Yeah.
Starting with Halloween on through. Okay. Well, thanks, Lynn, as always, for calling.
Okay, thank you. Have a great weekend and week.
Okay, you too.
Nice to talk to you, Linda.
Nice to talk to you, too.
Take
Thank
care.
you.
Thank you.
Okay, Jen, we're down to like 2 minutes. I know.
Holy cow, how did that go by so fast?
You
That's
did
so
all the
much to
talking. I just
say.
sat back and made questions.
Lung.org.
All right.
Lung.org.
All right. Chautauqua County. All right. So,
Yes.
as I said,
I love Chautauqua
I see less and less people smoking that in my circles, or they have quit. So, do you have any information in general about Chautauqua County? How are we doing?
So the lung cancer rates, so in public health, everything trends in 5-year trends. Okay. So it's not what's the lung cancer rates or whatever rates they might be year by year. They don't do it that way because public health trends. So in saying that, you have about a little over 1,000 people that are dying from lung cancer in this county.
1,000?
Yeah.
Wow.
Yeah, over, actually.
That's a lot of people.
Yeah, it is a lot of people, especially because Chautauqua was a little bit on the
Is it
smaller
a particular
side.
age group, do you know by any chance?
Your age group.
Okay, so
yeah,
retirement age.
Yeah, retirement
okay, so it's all
age.
caught up?
We're getting there.
Well, I mean, not
Yeah.
you. No. I mean, the smoking and it has caught up over the years, and so now at this point in their
Yes,
lives, it's
yes.
all a cumulative effect, I'm assuming.
Yes,
Okay.
and so if you're seeing less people smoking, that's a really great thing. There's a project called the Reality Check down, and it's statewide, and it's targeting younger children and teens, and there's a lot of youth that get involved with this program and stuff across the whole state. So hopefully that work, and the American Lung Association guides some of that. We've been doing some work on that.
Okay, and you work with Chautauqua County?
I work with the health department, and yes,
Schuyler?
yes, yes.
And
Chris
the
is
Chautauqua Health
awesome.
Network?
Yep.
Okay.
Yes, the Chautauqua County Health Network are my friends, and huge shout out to them. I was just at their big event, they call it. It's a COPD event that they do every year, and I got the opportunity.
4 seconds.
Okay.
What do you want to say?
Lung.org.
That's it?
Lung.org.
Okay. Jen, thanks for coming on the show today.
Thank you so much, Uncle John. It
You
was great to be here.
you informed me and a lot more information, and I hope my viewers and listeners took away at least a morsel of information, either to use in your own life or share with those that you love around you. And again, Smoking is something that maybe you got hooked into, but you can do something about it. So lung.org, check it out. Hey, everybody have a lovely, fun Halloween. Get out there and carve those pumpkins. We're going to see you in November. Holy mackerel, right around the corner. Take care, and we'll see you all again next Saturday right here, Chautauqua Sunrise at XS Chautauqua, 9 o'clock. And there's our little Halloween wrap. Bye now.